Hello dear friends, how are you today? I hope you are well. Today we are going to start explain questions and answers of dermatology. As we say that the skin is the mirror of the body, it means that every internal problem, every problem in the organ or any problem in their body, they can show themselves in their skin. That's why we say that the skin is the mirror of the body. Okay, here we are going to explain another question. A 43-year-old man comes for review. A few months ago, he developed redness around his nose and cheeks. This is worse after drinking alcohol. He is concerned as one of his work colleagues asked him if he had a drinking problem, despite him drinking 14 units per week. Upon examination, he presents with erythema as described above, accompanied by some pustules on the nose and telangiectasia on the cheeks. What is the most likely diagnosis? A. Mitral stenosis. B. Seborrheic dermatitis. C. Alcohol-related skin change. D. Acne rosacea. E. Systemic lupus erythematosus. Okay, we can see here a 43-year-old man coming with complaint of redness around his nose and cheeks. Okay, he used alcohol, but his consumption is in normal units per week. On examination, we can see some pupils and pustules and telangiectasia on his cheeks. The best answer here can be acne rosacea. Here we are going to explain it why the choice is acne rosacea. Okay, this is a typical history of acne rosacea. Acne rosacea is a chronic skin disease of unknown etiology. The etiology is usually unknown. The features of acne rosacea typically affects the nose, cheeks, and forehead. Flushing is often the first symptom, as we can see in this patient. Telangiectasia is common, later develops into persistent erythema with papules and pustules. Rhinophrema is common, and ocular involvement or blepharitis can occur. Okay, signs of rosacea. Here we have some signs of acne rosacea. Papules and pustules, as we said, we can see in this photo, papules and pustules. Visible blood vessels or telangiectasia is common, and eye problems like blepharitis and scleral involvement can be present. Thickened skin can be present, and facial redness like flushing we can see in acne rosacea. Management include topical metronidazole may be used for mild symptoms, example in limited number of papules and pustules but no plaques. We can use topical metronidazole. In most severe disease, we treat with systemic antibiotics, for example, oxytetracycline. Recommend daily application of a high-factor sunscreen. The sun is really important and has a crucial role in the presentation of signs of acne rosacea. That's why a recommendation of daily application of high-factor sunscreen is very important. Camouflage creams may be help conceal redness, and laser therapy may be appropriate for patients with prominent telangiectasia. Acne rosacea has different subtypes, as we can see here in this photo. Erythema to telangiectasia, we can see here papulopustular acne rosacea, we can see here papules and pustules, and phaematose, we can see rhinophrema here, involvement of the nose, and ocular involvement like blepharitis, conjunctivitis, we can see in acne rosacea. Here was a short explanation about acne rosacea. The patient coming with redness, flushing, and some pupils and pustules on his cheeks with the diagnosis of acne rosacea. Thank you for your attention.